Hello. I'm just wondering, has anyone ever worked when they were short-staffed? Has anyone had to pull extra duties because you didn't have enough people? Well, unfortunately, that's an everyday occurrence for the nursing field. It's gotten so bad that we actually now have nurses that are striking because they don't feel that they're not safe. The patients aren't safe, and patient care has taken a back seat to profit lines. And so they are standing up, not just for nurses, but also for patients. I think it's important that we understand that they aren't just looking for more money for themselves. They're looking for better care for patients, because nurses, that's what we do. We care. I decided to go ahead and I did a little bit of research. The first place I went was the Joint Commission, which is, they are the regulators of the healthcare industry. They're the ones that, give policies, put policies in place for patient safety. And unfortunately, it said in the policy, which is, in the policy, it actually stated that you need to have adequate staff. Just said adequate staff. Didn't say what adequate staff would be. Didn't go according to the acuity of the unit. Didn't go according to whether or not you're in critical care. Are you in the ER? Are you in pre-op? Where are you at post-op? Where it didn't go give any of that. It just said it needed to be adequate. And that didn't sit well with me. But in 2025, they did make a change. They have elected that there needs to be an executive nurse that actually will take care of policies and procedures within the nursing field. They handle the services. They deal with the staffing. I feel like this is a good move because nurses know what nurses need. And so that nurse would be more apt to take care of not only the nurses, but also the patients, because that is our first goal. That is our first job. So I think that was a good move. I think they should have given a little more clarity on what adequate is. Now, the BMJ in May of 2013 did say that anytime a nurse has more than 4 patient ratio, that the rate of readmission is higher. And then also the New England Medical Journal stated that if you increase a patient number by even just 1 patient, you actually increase the rate of infection or the risk of infection for the patients. Because if you have a patient that has thin skin and they could get a pressure wound, and you have to have somebody that will come and help move that patient around, there's several things that are required. And if you only have 1 person taking care of 6 people and you've got 6 different things going on, that's too much. So it's not safe. There was a CNA, I think in Alabama, that was actually fired because she was using a Hoyer lift. You're supposed to use a Hoyer lift with 2 people. She was understaffed. It was her by herself. She used that lift to lift a patient. That patient fell out of the lift and lost their life. She lost her license, and she actually was arrested. And that patient is no longer with us because of understaffing. You'd think that this would be a bigger problem. That they would be wanting to figure that out. Not only that, but if you think about it, excessive work on that, high job demands, it will stress you out. And if you are spread completely thin, how are you supposed to care for someone if you can't even take a minute to just care for yourself? You know how many nurses are working 12-hour shifts and not getting a break because the staff isn't there to do so? It's just a problem that needs to be addressed. And I think that they're working on it with the nursing. That seems to be a good idea, the nurse executive. And also, if we could there's a lot of nurses in the field. There are a lot of student nurses. We need to make the program a little more user-friendly, but I know that that's kind of a issue too, because not everyone can do what nurses do. but it's definitely a problem that they're looking at, and I'm very proud of these nurses for striking and saying they're not going to do this again. Thank you.